The last thing I'd like to talk about is asymmetry. And this comes up all the time with every patient, and every time I see a patient before surgery, I talk about asymmetry. A lot of us think that we are actually symmetric creatures. There's not one person on this planet where the right side looks exactly like the left side. As a matter of fact, if we take what we call a reverse mirror, if one looks at a reverse mirror where you're looking at your image in a reverse fashion, so your right side is on your left side and your left side is on the right side, you're not going to recognize that person. So it's very interesting, and we generally don't see asymmetry until we focus on it, and once we focus on it, it just becomes very magnified. So do yourself a favor, look at your neighbor or your significant other and look at their eyes, and you'll see that one just does not match the other. And the same is true with the breast. The breasts are what we consider sisters, but not twins. It's going to be like that before surgery, it's going to be like that after surgery. Now, of course, I'm not talking about asymmetry that's caused by surgery that is less than ideal, where you can create problems. I'm talking about in a woman who started asymmetric and breast augmentation was performed, and she's still a little bit asymmetric afterwards. And let's talk about that issue. That's uniform, and that will always be the case. There isn't one woman on this planet where both breasts are exactly the same. And to achieve asymmetry is not possible. Now, to make someone more symmetric, that is possible. But to have two breasts that are exactly the same, one's never going to achieve that. Because breasts are asymmetric not just because one is bigger than the other, they're asymmetric for many reasons. First of all, the posture of the patient. If one shoulder is higher than the other, then that breast is going to be lower than the other. The shape of the rib cage, the projection of the rib cage, the shape of each rib, the amount of muscle that a woman has, the amount of skin that encompasses a particular breast, the footprint of the breast, where is it sitting, a little bit higher than the other. Those cannot be negated or neutralized by just changing different sizes. So it's not like a cup of water where you compare two glasses and one is filled more than the other. You just fill one a little bit more and then voila, you have symmetric breasts. It doesn't work that way. So that's just a quick note about asymmetry. However, if this asymmetry is man-made, meaning that if it was caused by inadvertent surgery from either displacement, capsular contraction, well, that's what we're here for, and that's what we can correct. Thank you.